All right, another thing the president delivered on, because he said Congress could not and would not, is revamping Obamacare. But this was more than just a little revamping, my friends. When he had that moment with signing that executive order, a memoranda, if you will, I understand there's a very big legal distinction. But outside of watching a few law shows on TV, I don't understand what it is. But I do know that $7 billion that a lot of insurance companies get right now to subsidize the poor and those who also have low incomes, not necessarily the poverty rate, to afford health insurance. Take that away. Then what happens? Well, obviously, the insurance stocks are feeling the heat. And a lot of those people who get the coverage right now could soon feel the rejection letters. Dr. Mario Molina joins us. He's the former CEO of Molina Health. He's now with Golden Shore Medical Group. He's the big cheese there, the president. Doctor, good to have you.
Thank you.
Let's talk a little bit about what's at stake here. How do you feel about what the president wants to do, that we don't want to prop up a system that overly depends on government subsidies? At its core, that's a bad idea, whether you're Republican or Democrat, conservative or liberal, big government or small government. What do you say?
Well, you know, the people that are getting hurt in all this are the middle class. People that have employer-sponsored health care are going to be fine. People that are poor are going to be covered because of subsidies and because of Medicaid. And it's the middle class that's getting squeezed in all of this. What the president has done is laid out some guidelines of what he would like to see done in the future. But there's going to be no immediate change. The health insurance companies anticipated all of this.
How would it affect you? You've got a lot of Medicaid managed care. So how would that portion, how would that business be affected by what Donald Trump is envisioning?
It probably won't be affected. I mean, what this really does is it affects people who are getting individual coverage through the marketplace. And that's really an overall very small part of the entire healthcare insurance business. Some of the biggest insurance companies like United and Aetna have already dropped out. It hasn't hurt them. So I think that, you know, we need to look at this in the long term. In the short term, there will be no changes. The president hopes that this will spur competition, but it could do the opposite. Health insurance companies in 2019 could say we've had enough, and they drop out of the individual market because they're worried about the risk pool being split in two. The president's going to allow more freedom for skinny plans, which healthy people will want, and that means that more people in Obamacare are going to be sick and high cost, and premiums will go up. So now this is not an easy solution.
I understand what you're saying. I understand what you're saying. Part of the drive to fix this was that the vast majority of Americans who are well and not sick and not burdened with pre-existing conditions yet, and it's an important distinction, want more choice and flexibility in their health plans. Then the rest of those folks you alluded to, Doctor, those with pre-existing conditions or considered greater risks, would be in a pool amongst themselves, no doubt paying higher rates. The question is how much higher? Do you think significantly higher?
I do. I think that we're going to see healthcare premiums spiral upward as we bifurcate the risk pool into the healthy and the sick. And
but hasn't that already been happening? A lot of people's premiums have been rocketing, right?
They have gone up this year because insurance companies were sure that the president was not going to fund the CSRs. And so they built in big premium increases for that reason.
So if he's taking that away, or the idea of government protection away, the insurance companies have better reason now to leave, right? And then what are we left with?
I think that's a real danger, that the individual market just melts down, and you have an employer-sponsored market, and you have a Medicaid market for people who are poor, but the middle class is going to be left with fewer choices. That's a real possibility.
But the other possibility is that what we have now just grows and grows and grows, more subsidies to more insurance companies to prop up something that private commerce is not, only at the behest and the benefit of the government. That, too, is a little screwed up, right?
I think there's no question, even the Democrats realize that we've got to do something to stabilize the individual market for the middle class. And that's where the ACA has failed. If you're poor, you're covered. If you've got good coverage through an employer, you're covered. But the individuals and the middle class are the ones that are suffering. And we need a solution that's going to address them. And I'm not sure that the president's outline is going to do that. And you have to realize this is not an immediate fix. What he's given us are a set of guidelines or principles, but insurance companies are regulated at the state level by insurance commissioners who may have their own political agendas. So this is something that's going to play out probably over the next 2 years, not over the next 6 months.
All right, Doctor. We'll watch it very closely. Thank you very much for taking the time.